Thank you. Welcome to the Bodi Bεtẹ Pass Gentri program, when our salon people don't learn boku book in various areas of medicine, and they bring this program to now. Me, your name is John Fuller, me not a medical professional, me a business IT consultant. Me go now, so for just up there, big allergy, I don't learn boku book for them bring this program to now in a way that go in, way how now will appreciate them. Okay, so we will start. I was just going to a brief overview, who that we be and stuff like that. Then I will hand on over to Dr. Kamara. Okay. Okay, today at the 65th topic, 56th session. We only go now over 3 years, and today we deal with COPD, chronic obstructive pulmonary disease. This COPD, Bokuma no go understand that maybe, but Dr. Kamara will tell now everything we need to know about them. And I want, go, put the cat before the horse. I will let Dr. Kamara explain. But this thing has something really affect people them. Most of we, either whether through smoke, first time smoking, a smoker, or maybe through environmental issues, some of we they suffer from mentia. But Dr. Kamara will explain to you now, waiting they cause them, how they happen, how to manage them, waiting for avoid all that kind of thing, and they will explain to you now. Today is Sunday, the 28th of May, 2023. And like I said, Dr. MSI Kamara, I present to today. Dr. Kamara, senior consultant, emergency medicine consultant in Manchester, UK. He don't do a lot of talks and radio programs and TV programs, but he will explain a little bit more about himself. But for now, we don't join you before. I know him, and like I say, me, I'm a host, I'm John Fuller. And on the panel, we will get other various doctors there for various disciplines. Okay, and they talk about from GPs to gynecologists to mental health nurses. We get them all at the panel. We even get nutritionists and people there from public health. They're all at the panel where if you get question, most likely will get an answer for you. However, when they will answer your question, it not mean say I ignore you, or maybe will not take your question serious. You just ask some question and they way too personal. So we're not able to give that advice now, because with the advice, what they give a general advice, we may pick on anybody. So if we talk about something, we'll get an example similar to you. Similar, no more similar, but not to you, we talk to directly. Okay, if you get personal issue, I would say maybe speak to me offline and we will try to see how we will help. But personal advice online, I will not be able to give. Okay. And like they say, we will not know they get paid. I feel we do them. We don't do them the class over 3 years. Salon people that way on a salon or we get salon link. Then they bring this program to now. They bring out to in KRIO. Not to say we not speak English, oh yes, we do. But to the go and come in for a lot of people, they understand what to this. But normally we go mix doctor. Why the time they don't tell you the bad news? You mind your attention all the time, but that bad news is most half of the thing with the doctor will tell you later, nobody listen or you not understand. But yeah, so they break things down for let you understand. They hope say the people the way they back home, when they more need this program, will continue for join and continue for listening. If anybody wanna feel say somebody will need this program, either invite them there and they join. Or they are recording the video on Facebook and YouTube. They are send them the link, let them benefit from them. We need to do them because of one money, they get paid for. Okay. As I said before, this program, the recorded version will be on YouTube and Facebook. We also do on WhatsApp. We get a small group where if you want to join, I will share the link later. You can join the group. The group, nobody not going to post. We know more within the team now. They post, and they post all kinds of stuff, The only thing there for do with medical stuff now, no more the post. The thing that will benefit to people that are not the post. So if you interested, I will share the link, join the group. So you don't need to begin work and say, they go to text 2, 3 o'clock in the morning. No, we're very considerate as to the time we put something. If you text then kind of thing, maybe we must miss it as something very, very important that will save people their life. Like I said before, if you ask question, there's a different ways than they for do them. You either use the tool. And if you look, you get 3 dots now. I don't know if you see my mouse, you get 3 dots now. If you press that dots there, this thing will come up. We will say chat. Okay. So you can type here, and like you type on WhatsApp or Facebook for ask you question if it is on outside the environment too noisy. Or maybe, as brave as we or bold as we for show face, you can use the chat. But also, if you are asked question, you can raise your hand, you can press this thing in the raise your hand up, where I will go to you and ask you, ask you for let you unmute and you be able to ask you a question. Now, if you're able to do all this, no worry, just do it the old-fashioned way. Raise your hand up. If I see you, I'll come to you. Please do. If I don't come to you, we cannot mean I ignore. It just means I not see you. But once I see you, I will make sure I come to you. Okay. Like I say, if you get any queries and stuff like that, now we email address this, or you can send me a message on WhatsApp. If there's something for do medical stuff, like I say, mail to medical consultants, and then we submit it and they get in touch with you. So without further ado, I will let for now to Dr. Kamara for letting us through the session today. Thank you very much. Dr. Kamara, it's over to you.
I do. And I thank you for joining me today. Today we will talk about this big sick. If when I look at them, you get this langa name, and call it chronic obstructive pulmonary disease. In short, they call it COPD. You want the way they are, then go know what they mean, or well, I assume they go know. You want the way the free tongue, they're not going to know about that. But I know say some man know what they call asthma. Some man know what they call that problem for breathe. Some man know what they call that smoker's lung, smoker's disease. So the problem is, all man they feel say this sick now smoke no more they cause them. Well, we will find out soon. Say not to smoke no more they cause them. There's a lot more we go cause them definitely. But what we could talk about this now because for one, they underdiagnose people and we get them. For two, then they misdiagnose people and we get them with other sickness. Somebody will get asthma, then can easily tell and say he gets COPD, or then can tell and say he gets COPD when he get asthma. Or some man can get all two, And then of course, they affect people them where they in a different profession them in different part of the world. But believe me when I tell you this, not to smoke, nobody cause them. A lot more can cause them. But we will find out. As I say, the main reason we to make they do this now because they kill, and when before the COVID came, it killed over 3-point-something million people. With the COVID, and because it affect the chest, I sure say you don't go up to 4 or 5 million. I never get the current data, but clearly the easy for label for accept say definitely with COVID. But people don't die from this sick because the people that we then diagnose, we get this sick, they put them on high risk category. So we then can tell you say you for shield is now one of the category of the people we for shield. Now for tell you say this sick so important, the big Alleggio, the big world health organization then decide for dedicate one specific day to this sick when at the 16th of November. So now take note of that. 16th of November, now World COPD Day. As you can see from the picture on the right, look the small picking them. Who side then they, not to say then they smoke, now who side then they nine cause them for actually be prone or expose themselves to this pollution, we make now themselves can get them. Equating and called passive smoking. But we'll find out as we go along. So where will they begin for talk about something? Always nice for let we introduce and let we describe what's in this thing. So COPD, now not to just one sick, it's not a number of sick that we then put together. We now made them call them diseases, COPD. If you watch them, then the first letter I see when are chronic, that means not to sick where they begin, they end immediately, no, not lifelong sick. But if I tell you that, you could begin to say, this one they die. Well, although na sick way na lifelong sick, so you can live a meaningful and fulfilling life even with this sick if you plan well. So the sick, as you can see, it consists of them two big names here: chronic bronchitis at the top and emphysema at the bottom. If you watch the mortal man, the way God built we, this thing now then called the windpipe. Now they the breeze, the air where they breathe and they go through, and then he turn at the right, and then the other part turn at the left hander. So that part where it break now we divide and call it the carina. If you watch, you go there right beside the breastbone there. So if you turn this thing upside down, just imagine you turn them, you go see the fook them, the one at the right, the one at the left. If you turn them, if you are like we tick, team up by himself. So the tick get in trunk, like how Gentri for them, so you go see the tree gets in trunk, and the trunk na in this bit na ya. And then they branch them na the decision na ya, and then they lift them na the decision na ya. So as things stand, when you cut this thing na the middle, na so it look like when it is normal. Na ya outside the show so. That's why the way they normal. But when somebody get chronic bronchitis, see what in they happen to them. If they get this inflammation and they get this swelling, where they make this thing tight, because this thing get muscle. Then bronchial density, they all get ring and they all get muscle. And then muscle here, now they have for let it breeze go up and down. But when the things swell, you need it for doing work again. And at the bottom now, when emphysema, what they talk about, the fuk get this bit now, when they all the breeze what they take in, and it then call oxygen, what would they take in? They already come out, where we don't use carbon dioxide, 93, the tick then they use for their own well body. They see no more how they what they taking oxygen, we then they make for we, then they give them the carbon dioxide. But for that to happen, we need them here for work. If you look at there, you will see the healthy one them, and you go look, if you look at the left hand now, you go see the one they no healthy. You see how this thing don't broke. Whereas now, look how they did like nice bunch of grapes. That just tells you how this thing they, how they work, how they function. But chronic bronchitis, slightly different from emphysema. When you put them together, now definitely they call it COPD. But remember, if they tell you say you get COPD, that no means you die straight away. Sometimes you can deal with them for how many years, if you die with that sick, then now that sick then go kill you. What make as I say, we talk about that, if I know the statistics. It's now chronic disease, and in the world, then get number 1 killer, number 2 killer. This one and number 3. As I say, over 3 million don't die 2019, which is like probably 4 years. And that ending now in those 4 years, we don't get pandemic. Clearly, a lot of people, millions, in fact, now almost 8 million people and die from the pandemic. I sure say, Boku pandemic, that sick they suffer from. People then we don't old 65 and above, then they're more at risk, for catch this sick, and it affect we more, we young part than the world. The low and middle income country them, 96 they affect more, and of course, people in the thing say na tobacco, na smoking nobody cause them. Well, I tell you what, in them party and the world, we this one, like England, America, and all that, the Western world, 70% you could say yeah, now smoking. But in your partner at the world, like Africa, Salon in particular, not only 30 to 40%. The rest of that now, different in them, like pollution, like the way they do carpentry, that sewing, that dust. Some way they do mining, some way they do welding. Different things they wake up, and then some way they live more in the city, outside the dust day, from where they walk come, some might not go back outside in the upline. So that congestion, they all the thing, then they make people more prone for catching the COPD. The problem is, then they underdiagnose them. So far, in America alone, 12 million people and we not get diagnosis yet, but then get the symptoms. The one day we don't know 15 million. In India, 23 million, we don't know. The one day we don't know, then plenty past that well. I never forget the statistics for Salon, because I've been the struggle for going to that website. But I sure say Salon, one thing what we know is that then they misdiagnose them with asthma. Some people always sometimes they go know more about it than me do. But asthma is common, and they get very common characteristics like the symptoms them. So therefore, they can mistake them. And funny how, if you treat asthma, the thing they use for treat them, similarly like for opening the lung, for opening the fuk, now the same thing they give for somebody who gets COPD. So sometimes then they can mistake them for the other. As I say, underdiagnosed, misdiagnosed, and of course, not to just the smoking, because a lot more because of chemicals, fumes, dust in a walk, all that in the day. And if you look at the world status, this COPD, for sure how important it is, now the 7th leading cause of poor health in the world, 7th. So it just tells you say, this thing very important, and it's nice for them to talk about that, Now, obviously, when they diagnose you recently, if they just tell you, say you get the sick, you go confused, you go scared, you go definitely be upset, and you go be out of all sorts, But then no panic too much, no poor alert, because we can do things they do what you go do for help you, for let you manage this sick very well. When I go find out, like a video there, we go show you how people when they don't diagnose them with that in there, how they cope, how they manage for carrying on with this disease, how they manage for get a plan, we work for them, and then live for a long, long time. A very fulfilling life, because we can do, you get one thing with you. I don't know for Africa, but for we get that thing they call decision-making tool. It's a tool, it consists of some pictures, some questions there. And picture the way you go look, we definitely, if you truthful and you answer them genuinely, then go come up with a format for you. They will come up with a decision, say, this particular plan A for you, the other person plan B, the other person plan C. Not to one size fit all, no. So if you work with your team and you comply with your treatment, you manage which you're supposed to manage, you definitely go do a lot better with this sick than beaucoup people and way no so they get them. So waiting a chronic bronchitis, waiting they do, it irritate this lining where we don't talk about this bronch. It irritate them so that you know the small tail, then small cilia, then call like them small here where they go up and down. And then they have for clean them bronchia. You know, they have for clean them. So anything we did, they weigh extra, way heavier than air because that place in the air no more for them. Anything way heavier like secretion, like phlegm, like snot, all that thing then they now then thing ya now they push and come out we go, then you cough or sneeze or you know pull and come out. But if then thing ya this thing swell, then clearly enable for doing work. So because of that, the thing go left there and that will cause this bronch, the muscle for go into overdrive, and then it begin cause you for begin feel short of breath. Then you go begin wheeze. That's in the, you know, so that's the kind of thing. But of course, somebody will get asthma will get the same thing, the same kind of symptoms. However, the way they begin is different. I'm gonna go find out. You know, emphysema, none of the other one we've been talking about earlier. You know, if you watch, you go see. Now, this top one at the left, now, you go see. Now, so this bronch, what they talk about, this folk in main bit, and so they way turn way healthy. But look at him, where he gets the bronchitis. You see how he swell, and it's so narrow that the breeze that they go inside and come out. So obviously they cause you problem for breathe. If not the emphysema, you see, like how we talk about the bunch of grapes we've been there at the ending bit, but the longer under, you go see now say they completely empty. So you're not able for function. You don't broke down, as they can say. You're not able for pump that air come out way and go help you for it don't call for let you get rid of the carbon dioxide, you know, when I in the tick they want, you know. So that's the kind of thing. As I say, we don't talk about this this structure, the lungs them and the trachea. If you turn them upside down, just like the Tigo talk about. So he did the structure that, you know. So obviously when we talk about the sickness, we therefore talk about waiting at the risk factor then, the thing that will make you more likely to get them. Well, of course, all man know about the smoking. The problem is not to just smoking. Smoking now major criteria or major issue for that day within the Western world. Now the the developing world or low income or middle income country them now different thing. As I say, if you're older than 65, if you're exposed to air pollution, we now income on we part in the world, you get chemicals, then you get dust, you get fumes. Especially certain profession then they, you know, they're more prone. And of course, this thing it can run their families we man no know. So before they diagnose you, then we actually get to find out whether you get this sick, this alpha-1 antitrypsin deficiency. Now, long word, but it means AAT. It means person will get he more likely to get this sick than somebody who not get So before they diagnose you, then go get for check from the blood test for see whether you get or not, and then go know how to plan you. So you will see exactly which is the risk factor then. Well, of course, smoke we don't talk about, but again, the smoking you will see what you talk about how this bunch of grapes very nice now, but then when you look now, you will see how they don't broke down, you know. And mainly now the smoke now they damage that thing that they will feel like here, you know, where like then they do the job for remove all this extra mucus, snot and phlegm, you know, so that the lung go work properly, you know. Again, as I say, if you not do the blood test at the first time we don't go see for diagnosis, then can't rule out whether you get that one with the run families. So now only with that, now you go forget the diagnosis, say this one, the run families. So therefore, before check the other one, them. The picking they will get for born, you want to they're alive already with our first degree relatives, you know, and then counting the day, you know. So I like this slide because we think it compare, as I've been talked, then the misdiagnosed asthma for this COPD. Now, if you look at them, as I said, then very, very common, the symptoms they wouldn't get because they come with this shortness of breath, tight chest, difficulty to breathe. But COPD, a chronic thing, and it progress. You get stage 1, 2, 3, 4, where in the end now the lung can't do anything, and then the impact on the heart, and then the person they end up for die. But if you control them, you will live a lot longer with them. You know, asthma now, most of the time, although you get something we can cause inflammation, but sometimes then you can get this thing we then call allergen, thing where you're allergic to. Now I make they can check people and we don't get asthma, or see whether they get allergens to something. Like the one day where they paint, the domestic people, the way they clean, where they use them bleach, them cleaning agents and all that. You know, one day we get eczema, one day we get hay fever. Then kind of people and they run in families on them, they can more prone to become atopic, when they can become asthmatic. You know, As I say, the main cause of COPD na smoking. Other than that, in Africa, are different. However, asthma now more of allergen and inflammation. Can cause them. The asthmatic, the one who get the asthma, they automatically develop the COPD. No, not so it be. Whereas the COPD now, that's where they come gradually with the smoking, especially if they smoke heavy. For the first 4 or 5 years, maybe okay. By the time you get to 10 years or 20 years of smoking, the lungs there now, they become damaged. Then they be as elastic as them in there. They become rubbery, very red like rubber. So they now go for contract and relax. As a result of that, you're not able to get rid of all the things that we don't need. Because of that, you're prone to getting infection. But the other thing here is, as I said, them two things can they one with the other. So man can get all two. So man can get one or the other. And if you get all two, we definitely need for treat all two. There's no questions about that. So if I say treat the all two, well, of course, you need for know who signs and symptoms them, who you they get of this COPD. People the way they cough, especially that the way they cough in the net. Around 1, 2, 3 in the morning, it make you not able to sleep, it wake you up. For let you breathe, you get for find that difficult until you get for press on the chair. Who say sit down for help you for push the air in and out. Small exercise until waka no more climb up the stairs. Now in that you begin, so man that you can see begin in lips them begin pulse them. Like they pulse the lips because they struggle for breathe. Similar thing we know they used to do, walk around the block now who you get for stop 3, 4 times, and of course that wheezing. That you definitely go hear from somebody. But again, if you not get the diagnosis of COPD, nobody no go tell you say now you get until they do the test them. And they get different tests them for do, and tap the back end because for sleep na net, they get tired. So instead of you able to sleep na net, now morning now you go feel sleepy. And now you get for grab go walk. Because you forget the lungs for operate, you go definitely be prone for more infections than somebody will not get them, And then if then they watch you, then they near you, you go see say the lips that turn they can blue. That is now sign for say this person no well, now forget and go hospital. So when you for seek help, if you get any of the signs that we don't talk about, the symptoms we don't talk about, please, not wait till tomorrow. Begin look after them and make sure you say you write down all them things and look after them. If you see say this thing they last more than 24 hours, they respond to you inhaler. Well, now for begin for an hospital load or call 111 or 999 or whichever, But one thing I can advise people, if you don't manage the symptoms until you're in the early stages of them, you manage to get okay. Please do ya at the beginning of the people. Not change your medication and not stop for taking medication without you not talk with your doctor or your healthcare provider. It's very important. It's very, very important because now so people can end up because they have more problem. So remember, say that is very important. And if you get the symptoms then please not wait, take 24 hours. By then you go down too late. You need for do what you need for do. So if however you for control this is not the thing that we go make you say I will for control and we don't call non-emergency. So if the symptoms just they last between 6, 12, 24 hours, okay. They respond to you, inhale them, okay. But if I call, of course, for waka, like how you been the waka, now you need for begin take a rest 2, 3, then you begin for talk. This is not right. If you need more pillar them than you've been the needs, until you need 1 pillar or you don't need them at all, now you need 2 or 3, then definitely you need to think about it. Well, this one, now for try and look for hospital road. You feel more tired, and then of course for breathe it become much of a difficulty. The inhaler, then they walk and you take them more often than you've been doing. So you've been taking them twice a day. Now you don't take them 4, 6 times a day. They walk, then I for begin think about that. So important for know when. The other thing we can make people and then here with the list all, but of course, if you lose weight, important for make say, this not forget and check to. If you leg then they swell, your ankle then they swell, and they know one day swell, well, you get for check for find out whether now something else, not to just the chest, because the kidney can cause that, the heart can cause that, the liver can cause that. There's a lot of things. So now when you go to the doctor, he go check you, he take your history, and then assess you, examine you, and then you go do some tests that will go actually prove that. If you get more morning headaches or dizziness, you need to check that out, especially if you get for do with the shortness of breath. If you cough and then you get phlegm, you get snot, you get smooth way they pull out, make sure say the color is clear. You know, if you red or you brown or you green or yellow, then sometimes you don't get an infection. You need or begin get checked out. You know, they'll get for you antibiotics and other things that, you know, if normally it's just plain and, you know, very light, but now you don't thick, you definitely get that checked out, you know. If at all you get flu-like symptoms, you know, they feel cold, they tremble, you know, they feel pain at the joints and things like that, they get confused. And you know, for rest now, place all day, you know, they up and down and they become forgetful because you know they sleep and it's dizzy, then definitely it's nice for you get checked out, you know. Again, if you get, you know, weakness or you just get tired no more, and nobody need for explain that, but then you get the shortness of breath, importance for no say, definitely you get checked out. So when you get to the doctor, for him for diagnose, say you get COPD, he definitely get for take you through your history, your medical history. They go ask you about your smoking, whether you be not the smoke, or you don't ever smoke, or you don't cut off now, or you still the smoke. You know, they go ask you, you work what been they do. You know, whether you don't expose yourself to all the things we don't talk about. The one the way in a carpentry, masonry, then the way they even they mend them board them. You know, then they work in their minds them. You know, whether they work in a city and all that, or a family history of that. You know, then of course they go get for investigate that. You know, they go ask you whether your breathing affected, whether when you do small exercise number 9 that you get for begin rest. You know, you get cough, and if you cough, who's can cough? You bring phlegm with them or not. If they get wheezy, how long then they don't take place, you know? And of course, then go do the exam for you. So the physical exam, you go listen to your chest, you listen to your heart, you check your blood pressure, you check your pulse, you look your nose, because certain day, some man get polyp in nose, you know, even get them. You know, no say you get them, you know? Some man get something in throat, now the voice box, you know, no say you get them. You know, and of course the ankle them, we don't talk about that. Because it's possible to say the kidney, the heart, you know, the liver can be involved and you don't know. So you go for one thing, then find out something else, which is quite good. Which brings me nicely to this picture. One at the right, one at the left. The left one, obviously they show you how, when you go take x-ray, we let them diagnose this thing for you, what it mean. Now you find you just hear the x-ray, you don't know what it mean. Now make I put this. That windpipe, oh, they talk about 90s. Now yeah. You know, and then the right long line that is black one now. So the right one in divides to 3. The top one, the middle one, and the bottom one. The left one now 2. You get one naya and the second one naya because the heart the naya. This bit where you see so that white bit there, now the heart. You know, and then white line here, then strip here where you see, now the rib them. You see, a nice, they say you say anything with black, now air, now breeze. Anything with white gets, you know, solid panam, you know. Now make you see that thing we divide the chest from the belly naya, we then call the diaphragm. Now the right one naya and the left one naya. And surprise, look at the bravidis, the belly, the stomach, now in this. So anything where they up naya from this line naya, now the chest. Anything where the bottom ya, now inside the belly, the abdomen. You know. Now the picture that we see so now naya, now the left. Well, compare this picture, just keep this picture in your brain and compare that to this one. You they see say definitely this one not to like how they did. This one is like barrel. But that's what the COPD they do to your lungs. You see that nice thing will be see way around, really beautiful and call them cupid. Look why flat now, you know, and this one as well. If they show you say the lungs they don't turn rubber, you know they walk like Adam in the walk. Same applies to this one. You know, no, but this one don't get the barrel chest, but look away longer. You're not supposed to see the ribia. You go see 4, 5. But if you see 8, like how they consider, you know, 3, 4, 5, 6, 7, 8, 9, then it means the lungs them not able for retract like how they've been there. You know, like where you breathe in, the lung go up. Like where you breathe out, the lung go down. You know, because you don't turn rubber now, you need him for do that. But that's what COPD they do to your lungs. And I think it's important for make people and see sometimes it go help people and for stop smoking. So this now just what you go do for diagnose. You know, for make the diagnosis that this person get them, as we talk already. All written deep in this picture, we don't talk about already. Okay, we don't talk about a lot of things then, but for add to them, then we'll get this way they call spirometry. Where now some big tube where you put big round, like where you get like donut. Then you get this thing with the blower for see how the lung they work. You know, and then you get that way they put now the finger, where they call pulse oximetry. You know, then they help you for show how the lungs in the work, how much oxygen you get now your chest will for help you, because if the oxygen low, sometimes they make the person they feel dizzy, now make the person they feel confused, you know, and then they can tell you sometimes I make the lip can blue and the fingernail can blue as well. Then you get this very, very painful blood test, when they call arterial blood gas. It's really painful, but the person is a bit and the person is lucky, sometimes the day is not that painful. But it's only important because when you do them that way, you actually go tell the true level of oxygen way there, like the blood. You can do them through the vein, it will give you an idea, but if you really want to get the exact amount, how the oxygen in the lungs, then you need to do that. Now I make note to all tending to do them, then do them only to people and we supposed to get them done. You know, and of course, because we don't know whether the heart involved the leg in swell one, therefore do this thing we American man call EKG. We in England now we call it ECG. So man know I'm saying they call them heart tracing. You know, you go check for show you whether the heart involved. Because believe it or not, something we don't call cardiac asthma. It sounds like asthma, but then they know to the lungs them, now the heart, now they cause them because they fail. But then they're a topic for another day. And then of course, if there's anything else we didn't see on the plain X-ray, they want to do a CT scan of the lungs and the thorax to find out whether anything else we can cause that, you know, and then they go put you through some exercises them. We go help you for decide whether the control of the the sick okay or not. And if not, waiting for do forget and better, you know. So as I say, we get the stages then. You get the early stage, you get the middle stage, and you get the last stage, you know. Again, the first signs on tendon day, you just feel out of breath. When you do light exercise, like when you walk out up the stairs. If you go up the stairs, begin blow. Sometimes then the person can even be anemic. You don't know say you're anemic, and so then 2 things then they worsen up for you. Somebody who is anemic, obviously, when you go up the stairs, they feel tired. And if that person gets COPD, well, obviously, it will just worsen up for you. So it's fine for them to get this MOT and get checked out. You know, you can just blame the symptoms, say, oh, I tell you what, I'm out of shape, you know, or they get older, you know, but you don't realize that COPD you don't get. So it's important for make we distinguish. But at the early stages, now so you can present yourself. You know, you will get like that cough with the cough, get phlegm, it get a bit cloudy, you know, and mainly now morning them. If you hear someone say, wow, week now morning pass up, I clear my throat first, pass up, begin coughing, come on, before I begin feel better. Well, then they tell you, say, if you don't smoke or you live in a place where being very, very humid and very get all that kind of pollution, maybe you need to get checked out. You know, if you checked out, they say you don't get them, that's fine. But it's important for remember, say you definitely need to get checked out because you go save yourself the progression for going to stage 2 and then finally to stage 3 and 4. You know, but stage 2 now is more serious than stage 4, and stage 4 now is definitely more serious than 2 and 1. You know, that day now you go see plantain pan the video at one point you go see the man they carry the oxygen because that's the only thing will keep them in shape because they don't do the final stages now. You know, and then of course the management you see then get stage 1, stage 2, stage 3, and stage 4. Then they all, when you talk to your health provider, they go look at this plan for you, the one will suit you. For this particular point in time, not just for observe you every 6 months, every 3 months. But some Monday night for begin day on the program, you know, for join the program for quit smoking and get different things that we can help. You know, to the point they even get hypnotherapy all. You know, so all the things then they're important. You know. And then, of course, we don't talk about diagnosis, we don't talk about everything else. We need to talk about the treatment. Now, the treatment, of course, they're doing a doctor them or medical people, then go no dent here. But it suffice to say, the thing we then call bronchodilator, in fact, what you have to tell you is that because this thing now chronic sick, what can always happen or similarly happen is that when the thing relapse, like when the thing catch you, you know, all you get for doing now for relieve the symptoms them. And the symptoms that we know now coughing, breathing, and of course, chest infection. So what you can do now for open the airway by giving these bronchodilators, then inhaler them, then in the way you can see. If they open the airway and say, make them better for you. Anti-inflammatories now important for making you know because if somebody get pain, don't tell you injure your ankle, your foot, in your hand, they can say you get for take ibuprofen. Yes. But this one, not to ibuprofen, this one are steroids. Because steroids themselves, they get a quality for dampen the inflammation when they cause the tightening of the lungs, you know. So therefore, they're important. And the steroids then they for help you for do that. If they in tablet form for picking them, if they in liquid form, you know, and for that the way get problem for swallow, they say they can they in liquid form. Of course, the oxygen we don't talk about already. That day you can need, if at all at this point in time, the lung so bad that you need to get oxygen for clear them until when you get better, then take away the oxygen. But the latter stages now, you can need oxygen for carry on. If you get a chest infection, then of course you can need antibiotics, you know, but sometimes then they now viral. If you viral, well, if you get antibiotics, sometimes you not go work. But however, because now chronic sick, the virus could don't cause problems with the defense of the body. So therefore, the defense become weak, and so all the other things that we know for cause you infection when bacteria can cause you infection. And so therefore, you need the antibiotics. And to top all, you need the vaccine them. So as you know, say you're a COPD person, by the time the season they come, they say October, September, October, November, just no December, definitely the doctor will begin right to you for saying, say, Camo, can't take you flu jab, can't take you pneumonia jab, because they want you for prevent that from happen. You're very prone to get them sick. Then again, when COVID come, exactly that we do. We call people them, let them take the vaccine, protect themselves, and of course, rehabilitation, quite important. Very, very important. Now the family, they come in, not just one man sick, the family sick. But you go find out when you watch the video, you go see exactly what they talk about. But this is the key to the longevity for people and we go survive with this thing for a long, long time. Again, we don't talk about this, liquid train and all the, if not allergy, they can give you antihistamines, because if you're able to distinguish, but you can get that not go harm the person. If I totally get allergic component, well, that go help as well. If you get all two, asthma and COPD, then of course the antihistamine go help with the asthma side of things. Then get dentia as we go research, they develop, then get dentia then call clinical trials, we can help you for actually improve. And then of course then get long surgery. But then get for assess you for see if you're not candidate for that or not. They'll give you something we'll go help you for cough. The phlegm come out. And of course, the antivirals they will give you, because you need the flu jab for letting not cause you any problem, So how you go prevent them? It's nice for let we know, and we don't talk about prevention. So if you wash your hands with soap and warm water before you prepare your food, it will help you. Before you eat, of course, it will help you. Before you take your medication, or even when they look at you, instrument them, your breathing treatment and all that, clearly. And then, of course, after you don't do so thing, you need to wash your hands. If you cough and sneeze, like, where COVID been doing the sneeze at the elbow and all that, you might not be able to wash the elbow. But if you sneeze at your hand, obviously it's nice to make you wash your hands and things, because the ball can left at the hand and then you can pass on to somebody else, or even to yourself, because if you begin to touch your eye, touch your face and all that, of course, if you use the bathroom, definitely, and if you're there around somebody we get cough and cold like me, and I didn't hear a person with the sneeze and cough and that, so I can always try and avoid as best as possible. Social gathering, try for know which one that you go to. And if you do go, no feel shame more for begin wear your mask, because you need that for protect yourself, remember, hand sanitizers, then good for you. Put them in the bag or put them in the pocket somewhere where you go for help, that kind of thing, and obviously, if people do it, they can tell you I do, then get cold, but maybe stay away from them, maybe 6 meters or something, just for keep at the distance, so at least you go protect yourself, remember, keep your house clean and free of dust, because now that's in the Nike and Bogui. You get pet them, you get carpet and things and all that. Then they can bathroom, keep them free from mold and mildew. And then of course, try for avoid for walk or visit, then construction site them. If not did the work, then maybe you need to think about waiting for do in terms of changing your job. Avoid tobacco. Try for stop the smoking. The wood, like with people and then they cook with coal, with wood. I know say because of the blackout, because of the power outages and all that, we get that problem there. And of course, we will live in the city, this diesel and petrol, the fumes, the exhaust fumes, then can cause problems. We will live in that industrial estate them. Then they say because maybe one picking self, I know say not too long ago, we then say now because of the area we've been there, the pollution we've been there for now, black picking in London, now he end up he get this sick and he actually die of him. So important for let we know. Think simple things like then cook invent. Remember, you for make sure say they work properly, because then they help for take away all that then fumes then they, and try and stay away from the crowds, when the winter they cancel, just try and see what you go for do for protect yourself. Because if you don't do it, nobody no go do it for you. Again, this they talk about what you for do. Your diet important, the kind of foods, how you forget this equipment and clean, follow your doctor and your advice, comply with your medication, because now very important thing for you, the medication for comply with them, the treatment, drink plenty of fluids, and then of course, as I say, if you get problem for get help for give up the smoking, then it's important for make you ask people like we go show you who's right for go. Remember, if you rest enough, you sleep enough, you go able for feel better and you're able for provide better substances for yourself to go forward. You know, if you stress down, because invariably negative stress can cause problem for we, they weaken the system of the body. So therefore, you find for let we try avoid stress, negative stress, positive stress we all need them, but negative stress try and avoid them as best you can. Really, you know, and don't forget say you best buddy now your doctor or your healthcare provider. If he call you for any assessment, you know, then it's nice for make you come. If he ask you for make it tell you for make you go for the injection, please, please, please. I know say it's painful, sometimes they go say take two together. Important for decide say I tell you either you health or you ill health, you know. Now prognosis, well of course it's obvious say it is not all doom and gloom. Not to mean say because until you say you get COPD, that means not die. No, definitely. It progress for different people them at different rates. So Monday, because you get all that thing that we've been doing, but the way you don't know about underlying illnesses, you sometimes can be faster than somebody else's. You know, the life expectancy, believe me, I don't see somebody live up to 80, 90 with COPD. Waiting killer now in a different story. You know, so man now no get them, but he die very early. You know, so remember, do what you get for do and left the rest to God. You know, it is important for remember say not to all man, you know, go able for operate by this thing in terms of feeling good, but it's fine for let we know say not to all doom and gloom because there is help out there and people in the live with them a long time. You know, quit the smoking. You know, take your medication. You know, ask for the program, the rehabilitation program. You know, maintain a healthy weight, important, because people them not to say now all man will get body, now ain't go get this sickle. No, but obviously the person will get body, he more likely to get them than not because waiting to defend difficulty for mobilizing. And so because the lungs already prove as a a conduit for you, you will definitely get a problem with that. You're more likely to get them. Remember you flu shot. Remember you pneumonia shot. You know, and avoid all the chemical and they don't talk about. So now I get two video them. We go tell you now how when they diagnose them people here with this sick, how they fare on, what the family do for them, and they will advise to people them. They're not long, but I sure say all man will benefit from it.
I had some form of COPD 15 years before the diagnosis. Back then, I was a heavy smoker, very active with family and scouts. Our son is an Eagle Scout. Say, let's keep on going, and you don't have COPD, keep going. Well, it slowed me down definitely now that I'm 81. Not much has gone wrong with me up until the point where I got this COPD diagnosis. I was kind of taken aback by it and said, well, what's this going to mean? And I found out that it affects your breathing. I did notice it when I was on a business trip in Albuquerque with some friends and walking down the street, and they're way ahead of me. And I says, wait, slow down. I got to take a picture. Actually, I wasn't going to take a picture. I was trying to breathe. One thing I would advise people to do, and it happened to me twice, is go to pulmonary rehab. Continue the exercise. Get up and move. Exercise, and get some more exercise. The other thing is, if you're not honest with your doctor, you're kidding yourself. He's there to help you. And you better listen to him because he's got the expertise and the training and the skills to probably improve your life or prolong it. And if you want to prolong your life, you can do that. The mental aspects of COPD are something that really don't faze me or bother me too much. I've never been depressed or gotten down with the fact that I've got COPD. Life is too short for that.
All right. I hope you enjoy that one. This and the other one.
Diagnosed COPD has to be one of the most horrific events in anyone's life. And when I was diagnosed, it was something that really was not talked about and nobody knew anything about it. when I feel that I was short of breath and didn't know why, the first thing I decided to do was see a pulmonologist. He gave me what they call a pulmonary function test. And then he said that you have 10 years to live. There was no other conversation. There was nothing about rehab. There was nothing about rehab class to help you stop smoking. Nothing at all. 10 years ago, in 2000, when I was diagnosed, I don't know how much is known about COPD, but from then until now, and you walk into a pulmonologist's office and they tell you you have COPD, there's a lot of talking there. They're going to talk to you about quitting smoking. You have to eat properly. You have to keep the stress levels down. You gotta keep moving. Some type of rehabilitation. You need a support group. You need your family. You need somebody that you can talk to, and somebody to put an eye on. Open and honesty is the only way that I know to be with my doctor. I'm going to ask the hard question. That he is going to be ready to give me the answers because he knows that I'm serious about managing my disease. Having a caregiver is a plus for me. They're here to help me, but there are things that I just can't do for myself. I don't want my caregiver to just wait on me hand and foot, and it's not necessary. For any COPDer that's listening, just know not to give up. Never give up. Never give up. Keep that spirit. Have that conversation with your doctor. Let him know what's going on with you. And just keep digging for knowledge. I want to know more because the more knowledge you have, knowledge is power.
So you see, Mambo and Nasinamo, the Mami and that part with wealth, they not just resign, no, then walk. You see, in a family thing, you know, that support is needed definitely, as you can see. It's now 2001, and I tell you what, Titi did this maybe they're alive. Unbelievable. But that's the kind of thing we talk about, you know. So important for let you know, say, that's it. Now waiting God say no. You go for work towards that. You go for do what is necessary to make it happen. So as I say, make an end with this one. So people in field say they don't get this thing that they say if you smoke, you know, and you don't get no symptoms, then that means you don't get COPD. Far from that. But people in we get them, they don't know so they get them until they get to a point where we say there's no going back. Then they diagnose them. They make it important for quit the smoking as soon as possible. And as we say, not only the people that they smoke, we don't find out already. You know, not only the people that they smoke no more go get them, definitely all that thing then the way they cause we don't know about already. The pollution and the fumes, the exhaust and all that, they say can make people and get them, you know. So then they can run the family. Where you not be know about it, not till you fall say you take the wrong genes. It happens like that, you know. And they can understand, or people can tell me, say, well, you know, I don't smoke all my life. Which mean for left now, because if I left now, nothing will happen. It doesn't work like that. Definitely continue for smoke. Well, of course, the shorter it will be for you for let you get the disease. And the sooner you get you begin go to the later stages, then obviously the sooner problems will begin happen. And if anybody tells you COPD is untreatable, tell us say no be so. Definitely, although a chronic disease, but you can manage and if you do them properly, you go able to get benefit from that. There's no questions about that. Not only the old people and the get more, as we say, mostly na the 65 and above. But it don't mean say young person that they get them. You know, I get testimony where somebody sent to me today, where the person less than 50, he actually died of them. You know, so it just goes to show you, they say once you don't get the diagnosis, nothing other you go do for manage the symptoms. Well, we know say not to that in the case. There definitely ways for manager. As you can see from the video, they live a fulfilling life. All the two people in the way give the testimony, and they say you can get addicted to the oxygen. That's not true. Oxygen you just need it for support you. If you see you begin need oxygen for a long time, it means the disease don't progress. But that don't mean say you're addicted to them because they can take it away as long as the lungs they perform well. So I don't talk too much now. Now the time for let we discuss what happens. So thank you so much. for listening to me, and I'll stop so far.
Thank you very much, Dr. Kamara. We found them on another waiting the doctor don't see. We don't explain to we. I believe they don't go into detail. Where I first hear this topic, say now they do. Obviously, I tell us me no to medical, professional. So I therefore do more research before most of them don't join in the past when I know. Not so just people that already smoke. I'm not take real situation as alone. Second-hand smoke, bokunaton. Then tell you they keep on the entire for Brookstone. I'm sure Boku of know about that. We get Bome, for example. So they can go to it. Apparently now they say they get on a King Tom as well, but they all maybe sabi anyways. That they were already by Fergie Junction yonder. Imagine the pass yonder. Imagine everybody in a salon where it's map now crowd. You not get 1 or 2 people they smoke anyhow. The fumes for motoka. Then kitchen them. So then kitchen they can get na do. Remember, well, I don't know for now. Well, last day I go see and they try for use a lot of stove now and charcoal. But imagine they tell them they use firewood when they cook inside that fire. The amount of smoke we can pack inside that kitchen, when you go inside that we come on and do, God knows how much fumes we can don't smoke. We can don't inhale as second-hand smoke. So this is very important. I pray say the people that we need for Yeri, let them Yeri and the people who suffer from let God make them get a way for them seek help. So I can begin to take questions them now. I'll go to somebody is here up with an iPad. I'll ask you where you're on mute. Let you introduce who that are you. Then you ask your question, please. Yeah. iPad. Unmute yourself, please. Okay, I will continue. So now, if I'm now the time now for if anybody get questions for ask, at the time this for let you ask. I'll just see if anybody else don't ask question in 19. Okay. Okay. Dr. Kamara, why would they wait for people then for ask? Because I'm sure waiting I don't talk about so boku of we can relate to them. I need to talk about say just people that will smoke. I talk about people that we know about situations that we can don't lead to them here. Or maybe we know somebody who don't go through, or maybe we get symptoms. Now, Dr. Kamara don't go through some of the symptoms. Now, what I want to ask is, then waiting at the negativity for, say, for example, I'm not saying Dr. Bell don't tell me already say he didn't at the panel, but not good answer. But I'm sure maybe you could try for answer this. In the case of Bella woman, with the smoke, waiting at the impact, not just to the mama with the smoke, what about the pikin? When it comes to something like this, is there a case say maybe they tell you the mama get the belly, he smoke, and then they might lead to maybe the pikin later on in life, didn't they affect them?
That's a good question. I mean, as I say, whether it definitely get a direct impact on the pikin. For one, the woman will get belly, so attending the and they try for new, Now, yeah. The difficulty way we get here is they can be small for dates, picking them. All right? Okay. Prematurity very high. The threat of losing the baby, like where you get miscarriage and things like that, definitely high. And of course, if the pikin premature, the lungs them definitely less mature. As a result of that, they keep prone to infections, And if you, the mama, being gets this antitrypsin deficiency, alpha-1 antitrypsin, and you don't know about them, then you continue for smoke. Well, clearly the pikin don't inherit that gene the way you don't know about, and then the pikin goes. So there's a lot of permutations where you get pan this thing. As I say, for one, it affects you, the development of the pikin. For two, definitely the risk of prematurity is high, and of course, if at all you get that alpha-1 antitrypsin deficiency, you can pass on to the pikin. Then, of course, you get the added trouble of smoking. Plus, you yourself, the mama, where if you begin smoke, well, clearly, the episode, because if you know well, the baby self know well. Because if you get a chest infection, what happens? The pikin rely on you wholly and solely for your own survival until you come out in this world. So clearly, the help. because you need your lungs. How this belly they big, with the baby they mature, now so they affect you breathing because the lungs they go up. You know, and I make Bakuman towards the end of in term, you will see and say begin get heartburn. You know, go bullet down in back. You know what I mean? You will get pillar them. You go do on inside. All the things that they need for breathe. You take a full breath of air because the lungs then moved up, then pushed up by the baby with the grown at the belly. You know, so all of these things affect the picking, and so therefore, advisably, in fact, most women them, from which I don't see, if then they smoke, the moment they tell them say they don't take in, they don't conceive. I tell you what, then they make every effort for cut down on the smoking and maybe give up or say kada picking day, which is a very good thing. So you know, it's an admirable thing. It's a sacrifice woman and take they can make, and that for me is something I could take my hats off to them. You know, but it's a good thing to do. And so, man, after I don't give up that, until you know, go take up the smoke again after the baby born. So in some ways, it's a win-win situation.
Okay, thank you very much for that. Okay, for we were in England. I don't know for Central Europe and other parts of the world, but in England, there's this thing where they take a cultural hold. Whether people recognize them or not, I'm not sure. However, I'm sure as a doctor, I will see you, Dr. Ture, when I go to see them here, they come through. What's the impact of, and it's not, we're not there for criticize people, their lifestyle really, or criticize a company, but vape. What's the impact of vape compared to the smoking and around COPD? Has it got any relation to her? Again, impact?
Well, vape, you know, go say go cause COPD, but vape equally dangerous. Equally get you risk them. There's no questions about that. The people in their way don't really go bad because they take vape. Then picking them, we go there now see them. Mama, papa, they do them. Then go experiment. Then say once it, you know, and then take on that. Then clearly they end up with intoxication. There's a lot of toxic substances with the panatin, you know. But of course, if he help you for give up the smoking, then you can say maybe that's a positive. You know what I mean? So in anything, I always like a balanced approach. I don't just give the negatives. I like the positives as well. If he help you for stop the smoking, well, clearly the nicotine and all the other cancerous or carcinogenic substances way deep and that in there, it obviously go help you for stop them. But that no means say the vape itself not get your own side effects. No, definitely you get that. Like everything else in life, you get pluses and minuses. You get risks versus benefits. And so if from the point of view of giving up smoking, quitting smoking, the vape, yeah, fine, I agree with that. But there are other things you can do other than vaping. You know, you can get gums them, you can get patches, you know, you even go hypnotherapy. A lot of things you can do. You understand? But if you do decide for vape, then go ahead and vape, but at least make sure say you take care of the side effects, read about them, make sure say you don't get any allergy to the components, you know, sit down and discuss the other options where you get with your healthcare provider or your doctor, or maybe a respiratory consultant, when I go take you through all the things. So it's important for know that, you know. Me, I can always look at things, the pluses and the minuses, and which one will suit you best. Not to one size fits all. You know, get something bespoke for yourself, and I think you will benefit from that.
Okay. Yes, Dr. Bell. Dr. Bell?
Yes, hello. Sorry, I did on the road with the family.
Yeah, I understand, sir.
I just want to say a few things. First, concerning the pregnancy, as we all know, smoking during pregnancy is very, very bad. Not only because of the smoke, but also because of the nicotine. Yeah, the picking. If the woman is smoke during pregnancy, they receive nicotine through the placenta. And where you receive the nicotine through the placenta, then kind of picking they can get addicted to nicotine. So when they're born and they're not receive nicotine anymore, then they get what they call, then they get this withdrawal from nicotine. So they can really they shake. People can get oh, they picking cold, they picking not cold, then they feel cold. Now the nicotine, when the nicotine withdrawal, then they affect them. And then them picking and they, if they're not take them, when they're older, also man can want try. Yeah. So as that picking they try with 12 or with 15 or with 19, that picking they become addicted to nicotine. So I make me work and get patient them, woman the way they want to get belly, where they smoke, work and explain to them, even man them back. We man they smoke, the spam count the low. The spam count the low. So when they can I explain to them and say, well, when I go for stop for smoke, as I read the statement, then they get for heart. There are not, and no, up to about 80 to 90% say the mama been smoked during the pregnancy. So I can always tell them, say, well, if you no want for me to begin, they get the same problem like how they get to now because now mama smoke during the pregnancy, una supposed for stop for smoke. You know, so yes, if in like for example Germany now, they don't even allow people that for smoke inside motor car with picking inside. Because in order for only for do with the smoke of itself, you also get to do with the nicotine. Yeah, because when if they become passive smokers, then they can get addicted to nicotine later on. People can still say, oh, because mama and papa they smoke, they don't see the out and they smoke. Now you make the picking, then when them say picking, they begin smoke. Not only the reason that the main reason are because they don't already be addicted to nicotine, either when the mama get belly, or when I'm in baby, where papa and mama they smoke inside the same house or inside the same motor car with them. You know, so and then they now, if they not take them, when them older and then begin smoke, that tends to get a higher risk now forget COPD. You know, so I make with the advise people them for make them not smoke when they're pregnant, with the advise parents them let them not smoke when they around picking inside motor car or inside house. I mean, generally they for stop smoking in general, but if they want smoke, please not smoke outside picking day.
Thank you very much, Dr. Bell. The reason we make up the ask that thing about vaping now, because it become a cultural thing now. They see even small picking them all picking as young as, I don't see as young as about 8 to 10, that kind of age, they do them. Now, obviously, I believe say most of the number they do them outside their parents and they, you know, but then they do them. And I make up the ask for let me try for elaborate on that on the risk. Another thing
Sorry.
Yeah, go ahead, sir.
Now one thing I want to concerning that. There was this notion say if they create the vaping for make people then when they smoke and stop for smoke, and that was a good thing. But now when they find out now say that the other way around, a lot of people then they start with vaping, especially young picking them, they start with vaping and then they go on to cigarette. So the thing where people they actually try for avoid, the thing where they actually try for do was for make people the way they smoke step down to vaping and then stop for smoke. But unfortunately now, yeah, because of cultural reasons, it don't go the other way around now. Now that's beginning they use now, and then they start then go up to cigarettes. You know, so I can always tell people and say if I get young people with the vaping, let them stop. Not to because of the toxins that we did it, really bad, but also then they lead them for go the next stage, smoking, unfortunately.
Thank you very much. Thank you very much, Dr. Bell. Another thing I want to ask as well, another thing we instead of getting your social status. Now this seizure. I know it might be a digression a bit, but if we not know, that's fine. We don't know, that's okay. We can touch on that subject another time. Because I remember I get a conversation with a friend and about seizure. Waiting now I take on them as in negatives or positives, because that's what they do as a social activity. So I want to know what I want to take on that. Whether it relates to COPD, that's fine. If it not relate, that's fine. But I just want to see that we talk about smoking in that context. Waiting on I want to take on that. Well, because me class has seen as smoking. But even they tell me say not to smoke. But
it is smoking. See, the difficulty we get here is it's a bit like, you know, what people know about is that the raw cigarette you put out But shisha, now more like people, like with grandpa them they smoke pipe. You know, they put the tobacco on the pipe, and then some man they tell you say the amount where they go into the long, when when the pipe is probably less compared to when the smoke from the cigarette, because what you do is the bonding and then the burning is the inhale and the rest of it, so you get a bigger percentage. The shisha itself, because now new thing, yeah, nobody even don't go through the research for tell you exactly what it contains, but I'm pretty sure you get some what you call them now, that's the way they excite people them, whether you call them activants or something or whatever, but then get them. And so definitely shisha is equivalent, maybe even worse than smoking. The problem is you don't get the raw data for analyze within all we know na nicotine. In fact, to the point now, we know say the company they don't pay so much billions of dollars where they pay that now they decide for putting in the packet. In fact, I think I exchanged some recording of one person we talk about this. Now one of the things that we actually help for they give up the smoking. Now the notion that the side of the cigarette say the general surgeon actually advises you say smoking is hazardous to your health. So cigarette can cause you some serious health damage. It did it on the side of the packet of the cigarette box. So now that you look at it and say, well, hang on. If then people here they sell this thing at the same time they want me to say this thing is dangerous for my health, well, I'm a fool for continuing for smoke. So therefore, I need for try for give up. But now it's because of the fact say all man concentrate on cigarette, forget the fact say shisha and of course the vape equally destructive and very, very dangerous is the problem we have. It's like how you talk about, peer pressure. Then begin to look and now say, you're very, fashionable for smoke, vape, because that's what it was. Like in the 20s, it was fashionable for smoke. You were the man, you were the woman when you smoke. And that 9 leader don't people them to that. You know what I mean? But going on down the line, they find out, say, hang on, people are doing so far. I know I lost a very close relative to this COPD. There's no questions about that. And it was a very painful death. Really distressing for the whole family and for the person himself will go. But shisha, because we don't get the details of what I ate, we don't know what it don't do to the body, we can't actually emphasize. But I can guarantee you it's equally as poisonous and dangerous like the nicotine we know about. And of course, look at an example, sniffing. That glue, sniffing where they picking them, or you get what you call this thing, na battery. What do they call this thing now? That thing where they sniff na battery. They can use them, and yes, it's a dangerous thing, but that they can kill as well. If you get the toxic amount on them, clearly it can cause you a problem. So that's the kind of thing you're talking about. It becomes fashionable, peer pressure, people then give in to them and they do that guys, but it's equally an social evil. No questions about that. As I say, there are other ways of giving up the smoking, not necessarily through vaping. There's always a way out with other things. Just group sessions. The nicotine gum, the patches. And as I say, hypnotherapy can definitely help with that. And of course, the family support and the rest of it, and the fact that it's not fashionable. You look at what it don't cost to pick in. Like the mama they tell you about, so the testimony we give me, he say you take cotton wool, put them na water, na glass, and put water pan them, and then take the cigarette we been the smoke, put them pan them. Give them a few minutes and see what thing they come from. He said now part of the thing and the way stimulator, we actually give them the willpower to give up the smoking. And it's been a number of years when we give up, and he says they testify to the fact that he feel a lot better with that. So there are always ways and means of doing it, not necessarily for vape or for being go past shisha. Shisha is definitely an equal evil. That's your take on that.
Thank you very much. Anne, I aspire to come to you. I'll go to Anne, then after Anne, I'll come to you, please, yeah? Anne, are you still struggling to unmute?
Perhaps you can unmute him, I don't know.
Yeah, I'm not able to unmute him. I go for ask, I'm letting you unmute.
Well, wait, maybe tell her lay right to the window.
And if you can't unmute, can you please send me a text, please, yeah? Yeah, Aspire 792-711. Please introduce yourself before you ask your question, please. No, you have on mute first. You mute the on. Yeah, there you go. Yes.
Good. Hello.
Yeah.
Hello, everybody.
How are you?
Dr Kamara from Holland.
Okay, thank you.
Yeah, so it's the first time this will participate.
You're welcome.
Yeah. So my question is, when you get this disease, is it possible to make a cure, or like this way you could live with for lifetime?
Thank you very much, brother.
Yeah.
Thank you so much. Yeah. The sick way, now make you see they already diagnose them under 50. Most of the time they can avoid for diagnose COPD for people when they're under 50. Once you don't cross 50 and you do smoke, and then all the things they will do, they find out, when they do the chest x-ray, they do the CT scan, they do the spirometry, they find out, see this person in lungs, then definitely because of this or this, either the smoking or combination. Once they don't diagnose you, I think where the person will live with now for the rest of his life. But that no means say that could kill him. I distress that, because the moment of my area, like when they tell them say you get cancer. Well, 20 years ago, the survival rate of cancer far less than the survival rate for now. In fact, some cancer today, if you pull them, you get 95% survival rate in 5 years. No questions about that. But COPD, because now chronic illness, they go up and down. You go get them, you get better. You get infection, you get better. You get now because we can do the lung, not the walk like I been the walk. The folk not the walk like I been the walk, because the way God make them now elastic. They go up and down as you breathe in and out. That's why they go up and down. But because of the nicotine, it make a stronger, it harden them. So now it make a like rubber, and the rubber now need to relax and contract like how they've been doing naturally. Because of that, you need it for doing work. So all the other thing that we don't need that the body way for come out, and as a result, because you need for breathe like how you for breathe, you now get more chances for get infection, and somebody will not be no smoke, or somebody will not be no get exposure. Therefore, the sick go there with you. But with a good plan and with compliance with the medication, and you carry on to do what you need for do, good diet, rest well, avoid all the other things that we don't talk about, you likely for live with this for a long, long time. In fact, sometimes the team will go over for kill that person in a different way when they think about it. So, it don't mean saying at the end of the world. It means saying that chronic sick, you can manage it well, and you will get on well. There's no questions about that. Thank you so much.
Thank you very much, boss.
So, Jimmy, I'll answer your question, yeah?
Yeah, clear, boss.
Thank you. So I can go now to Isata Fuller and Dr. Ansels. I don't know which one I will decide to take this. I've been given a scenario where I've been go salon last year, November, and I've been telling how it happened. The country really, really, really dirty. This is nothing to do, let just make this clear. This is nothing to do about politics. This is not something for do with say no more the country dirty. This is now we say for that personal responsibility as citizens. But make sure we will not do certain things. So from a public health perspective, what thing will be on advice to people then? I don't know, between Isata and Dr. Ansels, I don't know what's one our take on this.
I can go first.
Sure.
Yeah. Obviously, I don't get a public health background per se, but I think the general knowledge or the general advice would be that people will be very conscious of their surrounding. Keep your area free and clean all the time, make sure, say, your environment not get a lot of dust settled all over the place. We know Sierra Leone dust very, very beaucoup, so now for clean frequently, yes, you need a little bit of dust for, get immune, but clean as much as possible, because the more dust you get around, the more they encourage the environment to make, all the virus then settle all over the place. As we know, with COVID, obviously dust and cleaning became very important. They even talk about air conditioning, not for left on, because it will circulate, the virus then we will not want around. So make sure you clean a lot, and if possible, they talked the last time. I just come from Sierra Leone, January. I come with some cough way I not ever get na England. I cough na Sierra Leone for most of the time, na night during the day. Then work na England, that cough persists for about 2 or 3 weeks. I'll be worried if we continue, I'll go see doctor. And me not get cough so even when we get the worst winter. So I go put that down to pollution na Sierra Leone. So wait till me go advise, you know, as well, people that therefore continue for put something around their nose, you know, around their face, like face masks for help, you know, reduce the amount of pollution when they breathe in on a daily basis as they go about their business. That's all I can say for now.
Thank you very much.
Well, yes, please, I
yes,
want to add to that. The problem
sure.
and the solution multifactorial. Yes, I support all waiting I started on say. But first of all, we all now with small corner can play with individual role for reduce pollution. I know say salon, a lot of people when they build their house, so man can able to tie the ground and all of that. So if you didn't assign way the ground not tar, you can come together, you know, say Boku of the surrounding a salon, you could get like 4, 5, 6 mighty mansion, then you can get the shackles them around. The one they within at the mansion, then can come together and try for tar the road. Or, of course, if we able for advocates, talk to the government, make them tar the road, then they go help. Nigeria, we all may know say Lagos now in the capital city, then later on they moved to Abuja. What was the reason? I believe say population, one, overpopulation. I don't know Sierra Leone if we go able to move the capital city or try for create jobs in other major cities like Bo, Kenema, Kono. So we go get people for move out of Freetown because Freetown really don't overpopulated. And because of the high population, of course, the pollution not get for done. But as I said, mentioned, we all get for try for reduce the dust now with surrounding, try for the lock the window. Of course, you can't lock the window all the time, you go need fresh air. But when the place dusty, try for dust them. Try for, I know some people that can try for arrange with Guma for calm, help for pour water at the streets for reduce the number of dust. So we all get for try for see what we can do. And if you they do any job, if we listen to Dr. Kamara in presentation, the one that they when a carpenter, any job way related to pollution, if you they deal with them, make sure say you take all the necessary precaution. And also with Sierra Leone, not all job then they really train you about safety. So we get for talk, and I make I say the problem multifactorial, you know, you get for involve the government, whoever the ministry they in charge of safety, make sure say all them job then they were involved some form of pollution, people then getting proper equipment for protect them. Over.
Thank you very much, Dr. Ansels. He touched on, you know, all the areas that we for touch on. There's one more thing as well way we can add on that. The thing they really pass na street to call motoka. They know well, they service them well. Some of the fumes with them motoka they pull. Even the day now you luxurious motoka, the back of some of them motoka then the fumes where they come up at them, they come through you vent. Because remember it happened to me. At the tongue. The amount of stuff we come from event, I end up opening the window. It was that bad. Yes, the motor been deeper, you know, obviously the air condition and whatever, but because of what you don't come through, I be prefer for open the window than for sitting inside that kind of environment. Then so like where Dr. Hans would say, and waiting I tell us as well, they multifactorial. There's a lot of things that we as individuals, you know, as citizens, we get for do. We will get the know-how, then we try for sensitize people. You know, would I lobby Papa government? It doesn't matter which government or the day, I'm just talking about government in general. Would I lobby them? That's fine. Would I support the initiative as well for, you know, for letting help people do it? Because at the end of the day, it's not about who that they empower or not they empower, it's about waiting go benefit with people. Them. Yeah, Anne, let me come to you now. I'm sure you should be able to unmute yourself. It's a shame. I don't know what's happening.
Yeah, try it.
There we go.
No,
Okay, you will have to log out of the other one.
sorry about that, folks.
Yeah, you'll have to log out of the other one.
Good evening, John.
Hello, how are you?
I'm fine.
Yeah, what's your question, please?
You can't hear it.
No, I can hear you. I can hear you.
Hello, John.
I can hear you.
Can you hear me? Bloody hell. Good, good. I suffer from asthma, and I'd like to ask Dr. Kamara a few questions. Hello, Dr. Kamara.
Yeah, hello, sweet. Yeah, go on, sweet, go on.
I suffer from asthma, and I've never smoked in my life.
Yeah.
And I've had COVID, and I'm now going to a pulmonary class, which I would recommend to anybody. Your GP can refer you, but it's a very good class, and it does help you. It's excellent. Like I say, I worked in a factory with powder, and I think that's where I've got my asthma. So, you know, I've had it since 2003, my asthma, and I'm on sprays, and I just, you know, do everything I can. And Dr. Kamara, an excellent presentation and very helpful. Thank you.
Thank you so much.
Thank you very much.
Thank you.
And if you don't mind me asking, on those classes, what do they do?
In the classes, they give you exercises to do. And you go on the treadmill, you go on the bike, you do standing and sitting, and you do like dumbbells, and you march, and then you do exercises like your legs out to help your hips and everything. But it's like 1 till 2:30, and then you get paperwork after, which is really good.
You're finding it beneficial?
Yeah.
Yeah? Good.
Yeah, so it's really good.
Excellent, brilliant. I'm glad you said that. So how do you then determine when things are getting out of hand, i.e. you're tipping closer to the edge, i.e. you're getting a relapse? What do you use as a benchmark, as a you know, something to as a barometer, if you like, you know, to help to maybe trigger your conscience to say, hang on, ooh, I need to take some necessary steps to stop me, you know, tipping over the edge?
Is that with me asthma?
Yeah,
Dr.
with the asthma.
Kamara.
Yeah, with the asthma. What do you use to
I have a small nebulizer.
Right.
And I take that, and within a few minutes, it's better.
Good. So do you have like a peak flow meter?
It's manageable.
Do you have a peak flow meter?
Yes, I do.
And does that help you? Because normally the amount you blow on the peak flow meter is what we use as a gauge, as a guide. So if, for example, you know, somebody used to blow 500 and now they can only blow 350 or something like that, that is way too low for that person's, you know, normal being. And so therefore, that person would then use that as a guide to increase the amount of inhalers they take, the number of times they're using them, and maybe introduce the steroids. Now, if that doesn't work, then now they know that they need to be going to hospital in order to get you know, righted or clawed back from where they were. I don't know how that works for you.
I have 2 sprays.
Right. Okay.
I have one I take twice a day, and it's got steroids in.
Right.
And then I have a puff.
That's good. Brilliant. Well, thank you so much. You've actually helped some other people understand how you cope with your illness and how it is not all doom and gloom when you do have a diagnosis of asthma or COPD or a combination of both. Thank you very much for that. It's really, really been useful and beneficial.
Very welcome. Thank you, Kamara. Thank you, John.
Thank you very much. Thank you. Okay, my family, we don't go over, we don't almost come to the end of the program today. I go ask, some of you, I go don't see something pop up on our screen. Now, a survey we will do, and for try for gauge on how the presenter don't present today, how much you enjoy the show and stuff. No worry, where you vote, we're not going for no now that vote. It's just a way for let we capture something, for let we look at how they will make improvement. No matter how something good today, there's always room for improvement. We're not perfect, you know. This thing what they do, so not to this talk show and stuff like that, I mean not to present our normal day job, you know. So anything we want to put the another for affect me, but it's a way for let we learn. So family, then we don't come to the end of the program, and I can go around the panel now and ask all the doctors the way available. But then you and the final word, then we will finish for today. Dr. Rashid, you able to talk? Okay, Auntie Rugi. All right, I'll move on to Dr. Ansels. You want to get a last word? Okay.
Yes, yes, sorry, I was trying to, the try for mute, sorry.
Okay.
Thank you very much, Dr. Kamara, for the presentation. Thank you very much, everyone, for our contribution. On another read the word, the balding on our court. Make we all try for see what we can do, try for sensitize the young people them around we, but cigarettes, if anybody where they do a job where involve some amount of pollution, try for talk to them. And of course, if you travel in an area, or in an area where get a lot of old vehicles, as the woman don't mention, or very populated, and the air might be polluted, take all the necessary precaution. And if you start for experience any symptom, you get any persistent cough, for example, or you begin feel some kind of way where they feel, bland they feel, or you breathe in kind of somehow disturbed, see you healthcare provider. As we all know, well, Bodi, the better pass Gentri.
Thank you very much, Dr. Ansels. Dr. Ture, you been there around before. You get anything for add? Okay, Aisha Fuller, you get final word for people, eh?
Yes, firstly, I want to thank Dr. Kamara. Una all see it was a very, very well presented talk. So I think everything they that information they will not able for access the actual talk on YouTube. Our very best landed IT guy, TJ Fulago put them on YouTube. So please, if you want, reference anything Dr. Kamara don't discuss, una can go back, or we will not discuss on the program. Una can go back and reference them. It's very important for this talk to be taken very seriously, especially una way de Sierra Leone. Sierra Leone highly polluted as we all don't talk. And they go find, and as Dr. Kamara says, COPD is very underdiagnosed. So we therefore take matters into our own hands and try for do these things for ourselves, try for look after ourselves for your own well-being. Thank you.
Thank you very much. Auntie Aminata Jallo, you get anything for say as your final word?
I'll just say, good presentation. Thank you, Dr. Kamara, for all that information there as well. I hope they go sensitize people them and let them able to take control of their health if they get symptoms as well. I'll just also quickly remind people that would already diagnosed and on medication for make sure they know how to use the inhalers very well, and then they get the technique of the inhaler use checked every year at least for just make sure that they use the inhaler very well, because sometimes the reason why the medication not they work now because the technique don't poor, or or your dexterity don't to make older people and can get this sick most of the time. So there's something in dexterity, the way that they use the hand, they're probably not able for coordinate as well then breath. So maybe they can change the inhaler to different kinds. So that's one thing. So the annual review, they will check everything. If it's not, if people then they on medication and get sick already, then that is advice for. Thank you very much.
Thank you very much, Auntie Aminata.
Sorry, TJ.
Yes, sir. Go ahead.
For mute.
Okay, go ahead.
Fambuda, now thank you plenty for where we now come listen to this very important presentation. I believe say it detailed enough, and no matter who say you there, you can able to do something for make your environment clean and safe. And members say, when you sick, go see your doctor for get help. We tell Dr. Kamara thank for the detailed and important presentation and all the contributions there. This is important for we all, because no matter who side we there, if we say we country safe, people then healthy, that's the give we call that. So una continue for attend. Una thank you.
Okay, Dr. Kamara, you get a final word for people then? And we'll wrap up for today.
Yeah, thank you very much to everybody. And in fact, I just want to remind people, I don't know if people know how to use this this poll. Important for we, because we know that will be used for determine, how well would they do, and if they do how well, how we go maintain that. If we need to do well, what we will do for making good or making well. Now, the important thing that not to say anybody go find out who that you go be. We not get any problem with that. We just need to make sure say what you do na the right thing. So do ya, if they get problem for vote, when for no say one, na you don't get no satisfaction at all. 5 means maximum. You get maximum. It can be any figure, but we just want to know how we go for. Determine how we go forward. So when I thank you for when I able for left, all what we do for joining me today. Now, because probably the topic very important, because one way or the other, if you not get the sick, sometimes because you don't know, or because sometimes they not investigate you yet, or sometimes somebody will get them. And remember, this sick, but people will get them, they don't know they get them, because sometimes they misdiagnose them as they get asthma. So important for make you know, waiting for look out for, and that you need or seek help. And if you get help, it don't mean say because they don't diagnose you, it means you not go for live with this sick and do well with them. As Ms. Jallo, they say, sometimes they the technique of the inhaler and can let you down. So important for people and for learn how to do them so that they will get maximum benefit from the inhaler. And if they feel well, they respond to the inhaler, please, and for Fair Hospital Road, that and for go around the corner, or let them go and drip by you, then go begin you Shekuture or kind leaf or Rabenga or what do you call them? Atwood bitters and all that for drink. Please, because believe you me, the thing where they kill people the most, now the airway and the breathing. We don't lost a number of people we're not being supposed for die because of the fact that they not go hospital. So my advice to anybody when no say you need to get better, please, no wait, because the airway and the first thing we will take you out. So as we know, knowledge is power. If we don't benefit from this talk today, please invite other people shape the word, distribute the word, and make them go loud and clear. And if you need for actually tell somebody else about them, if they're on YouTube, we get WhatsApp group and all that. And if you get feedback for give you, or sometimes you the shame or talk to we, or you don't want to talk to we all Monday, you can actually inbox we. You can private talk to we, email, and then we go for respond to you and give you best. But please, not suffer in silence. As you see in that video, you are not alone. Not to you one grain. This is now all man you own. So do ya. As you know, well Bodi, Bεtẹ pass Gentri, and thank you very much. God bless.
Okay, family. I don't get much for say. The one that we don't learn book don't explain to our waiting they cause them here. I don't get anything more for add to that. I hope say we don't We know to hear it today. It will benefit you all going forward. On a good night till we meet again. Well, Bodi, better pass Gentri. Good night.
Thank you. Yeah.
Yeah, I try to stop the recording.
I don't know if I go left or not.